This week's safety video, we're going to talk about respirators. So first we're going to talk about when we're going to be using a respirator. That's when there's going to be an airborne contaminant above an action level, depending on whether that may be silica, chromium, etc. We will need to make sure that we are following the proper procedure for using a respirator. So number one, you'll obviously have to fill out a medical evaluation. This is a questionnaire where you will be answering some questions about your health as well as your medical history, if you're a smoker, etc. We also will have you get fit tested at Med 1. In this process, they'll make sure that the respirator is properly sealing to your face. For this, you will have to be clean shaven to confirm that you have a good seal. All respirators have an APF. This is an assigned protection factor. This is going to determine what the level of filtration the respirator is providing you is at. APF 10 is kind of the baseline, so that'll filter over 90% of the contaminants, and as that APF number gets higher, your filtration is going to obviously increase. When using a respirator, there are a couple things you need to do daily. Number one is going to be inspecting it prior to use, making sure it's not damaged in any way and that it is sealing properly to your face. Number two is going to be making sure that it is clean before and after you use it. A respirator that is designed to be used multiple times will need to be stored properly in a clean environment. It is also important to make sure you do not confuse your respirator with anyone else's. You can write your name on it. Employees do have the opportunity to use a respirator voluntarily. This is going to follow a similar process to if we're requiring a respirator. We're going to fill out a form stating that you're using it voluntarily and discussing what steps you need to take depending on which respirator you're using. Thanks. Have a safe week.